And those are available online afterwards as lasting resources on our website. Great question. It was going to come up later in Q&A, so I'll answer it now. Next up, I get to introduce Dr. Brandon Moss, who's visiting us from Cleveland Clinic, who will give a talk on neurosarcoidosis.
I just want to thank the Foundation for Sarcoidosis Research for having me and allowing me to speak today, and in particular Kelly Beyer, who has done some public organization for the event. So I'm going to talk today a little bit about neurologic complications from sarcoidosis. And I'll start off by talking about the prevalence of neurologic complications in the disease. So somewhere around 5 to 15% of people with sarcoidosis have involvement of the nervous system. And about half of those actually present with neurologic symptoms as their main issues, as their main problems. Eventually, somewhere around 80 to 90% of people have involvement of other organs as well, typically the lungs. So I just want to review the nervous system with everybody here. The parts of the nervous system include the central nervous system, which is the brain and the spinal cord. And then the nerves coming off of the brain and the spinal cord are the peripheral nervous system. So that includes the cranial nerves, which are above the neck, the spinal nerves, and then part of the peripheral nervous system also includes the autonomic nervous system, which controls a lot of autonomic processes of the body. Things like pupil dilation, things like heart rate, things like blood vessel constriction and blood pressure. So sarcoidosis can affect any of those. And it is very variable in terms of the symptoms that people experience and the manifestations that they have in their nervous system. So symptoms of neurosarcoidosis, they can be very specific to the point where you can figure out exactly what part of the nervous system is affected. But they can also be very vague. So some people have problems like difficulty with concentration, problems with memory, problems with fatigue. They can be similar to other conditions like multiple sclerosis. And again, like I mentioned before, everyone is different. So one of the most common manifestations of neurosarcoidosis is involvement of the cranial nerves, or those nerves coming off of the brain. And in particular, the facial nerve and the optic nerve are very commonly affected. So somewhere around 25 to 50% of people with neurologic complications have involvement of the facial nerve, which can present as an asymmetric smile or drooping of the face, difficulty with eye closure, so weakness on one side of the face and sometimes on both. For these complications, people do very well in the long term, so normally they make a complete recovery. The optic nerves, the nerves to the eyes, can also be affected. And on the left-hand side here, you just see a picture of the back of the eye, and you can see that nerve there, let me point to it again, right here, the little white part, is swollen, and that's due to inflammation. When that happens, people can have problems with blurry vision, loss of vision. Sometimes it affects color vision more than black and white. For this, again, it's over 20% of people with neurologic complications can have optic nerve involvement. The recovery from this is more variable. So somewhere about a third of people make a very good recovery, but a third of people don't. And then the central nervous system can be affected as well. So when sarcoidosis affects the brain, typically what it does, it affects the coverings of the brain. And so if you look on the left-hand side here, you can see sort of the outlines of various structures in the brain, and these little white spots are areas of increased inflammation on these scans. And that is really what is being involved here. So that is called meningitis, and that is the most common presentation when sarcoidosis affects the central nervous system. Sometimes what happens is that inflammation spreads from the covers of the brain into the deeper tissues in the brain, usually along blood vessel roots, and that's when you can get brain lesions, and the symptoms from those really depend upon the parts of the brain that are affected. In addition to that, irritation from those lesions can lead to seizures in some people, which sometimes can be very hard to control. And then finally, you can get involvement of the spinal cord as well. So we see that on the final slide to the very right here. And when sarcoidosis affects the spinal cord, again, it usually starts along the covering of the spinal cord and invades inward. And that's one of the characteristics that helps us separate sarcoidosis on imaging from other complications that can mimic it, both in terms of the symptoms that people experience and what you see on exam. And MRI for us really is the first test that we get, because it really has the best potential to help us identify sarcoidosis as opposed to some of the other conditions that can cause similar problems. In addition to the central nervous system, the peripheral nervous system can be affected. So people can have problems with numbness, tingling, weakness, and problems with balance. Here is just a picture of what's called a nerve conduction study. So what they're doing is applying a small shock to the nerve in the leg and seeing how well it conducts electricity below. And that gives us an indication of whether or not the nerve is affected. In addition to that, there is something called an EMG, where people take a small needle and insert it into the muscle to see the muscle's electrical activity, both at rest and when it's activated. And that can give us an indication of whether or not the muscles are involved and the nerves supplying those muscles are involved. So that's usually the first test that we use when people have symptoms concerning for a peripheral problem in sarcoidosis. And then another very difficult complication of sarcoidosis is autonomic nervous system involvement. So this can be a very hard diagnosis. It can manifest as unexplained burning, pain, or tingling. People can have problems with temperature sensitivity. They can have abnormalities with sweating. They can have problems with lightheadedness, specifically when getting out of bed or when standing up, and they can have stomach issues like GI complications. The best way to diagnose this is with a skin biopsy that shows that there is a loss of small nerve fibers in the sample that's taken. So if you look at the far right-hand side here, if you look at the far right-hand side, the dark squiggly lines are actually small nerves within the skin tissue. And when it's normal, you can see that you've got a lot of small nerves there. But in people who have small fiber neuropathy, you see all of those are gone. So we have a lot of standardized numbers in terms of what we expect to see for small nerve fiber counts. And when we take a skin biopsy and see that those are below normal levels, we can sometimes make the diagnosis that way. About 40% of people who have neurologic complications have these kinds of symptoms. And then, in addition to skin biopsy as a way of diagnosis, we can also do some tests of other autonomic functions. And by that, what I mean is the autonomic nervous system controls other aspects of the body. Again, those automatic processes like pupil dilation. We can do sweat tests to see if people are sweating the normal amount. We can do something called a tilt table test, where we gradually vary the angle of the table and see if people start to experience things like racing heartbeat when they're dropped below a certain level. So how do we know it's neurosarcoidosis? there are varying levels of confidence that we have in the disease. Everybody that we see, that we diagnose with neurosarcoidosis, should have a characteristic presentation and should undergo extensive testing for other mimics of the disease. At the next level of confidence, we're able to biopsy other tissue, non-neurologic tissue, that shows those characteristic changes of sarcoidosis, the granulomatous disease. And at the very highest level, we can get a biopsy of nervous system tissue itself that shows those characteristic changes of sarcoidosis. But we have to be careful there because there are some very eloquent structures of the nervous system, and we are reluctant to biopsy things that could cause people long-term injury or long-term problems. So we're cautious about things like a brain biopsy, in particular spinal cord biopsy. So treatment involves a variety of things. It involves immune suppression treatment, which primarily focuses on steroids, which are the initial and typically the mainstay of treatment. But again, because they have so many complications, we try and decrease the dose and duration of steroids as much as possible with things like steroid-sparing agents. And one of the most effective medications that we have for the treatment of neurologic complications are actually a class of medications called TNF-alpha inhibitors, in particular Remicade and Humira. And so for people who have failed other treatments like prednisone or a steroid-sparing agent, we often go to Remicade or Humira. Symptom management is very important in the disease. I deal with a lot of pain, and nerve pain can be hard to control. Hormone replacement is important. So sometimes people have meningitis that involves the pituitary gland and can affect production of hormones. Those need to be supplemented if they're low. Physical therapy and occupational therapy are also very important in terms of recovery. So there's still a lot that we don't know about neurologic complications of the disease. Although we have an idea about prevalence, these studies are very rudimentary and they're susceptible to bias. We don't know what predicts who will get neurosarcoidosis. It's very interesting. The most commonly affected organs in sarcoidosis tend to be the organs that are exposed to the environment. So things like the eyes, like the skin, like the lungs. The nervous system is very protected from the environment. And so we don't know why certain people get neurologic complications, whereas the majority of the people with the disease don't. We don't know if there are better ways to diagnose neurosarcoidosis earlier. Many of the patients that I see have often gone to multiple physicians before they reach me. There are often long delays in the diagnosis, and some of those are unavoidable because biopsy is still a very key component of diagnosis for us, and it can sometimes be hard to find a good target. And then tracking neurosarcoidosis. So right now we have no validated measures for neurologic complications of the disease. And so we're working to try and get better measures that track well with things that are important to people living with the disease and that can potentially be used for clinical trials. And then lastly, although we have a rudimentary understanding of which medications are more effective for the treatment of sarcoidosis, we still don't know if there are other therapies that would work better, and we still don't have any clinical trials within the disease. So that is a major goal within the field. So I think I will go ahead and conclude with that.